Hi, everyone. This is Nat Measley, founder at yourculturedesign.com, and it's time for a little lecture with Professor Nat. On this little lecture, we're exploring the business case for understanding the emotional well-being and mental health of your employees. As we know, the rules for our little lectures are simple. One slide, one simple takeaway. So let's get into it. This slide represents work that I had the chance to do with a client years ago. This client was a large regional provider of gas, the big gas station and convenience store chain in the greater Philadelphia area, 500 plus locations when we worked with them, thousands of employees. And this graph actually explains the business case for understanding your employees' emotional well-being and providing support and services for their mental health. So rewind, this is now 10 to 15 years ago, and this large gas station and convenience store chain was looking out at their healthcare costs for their employees over a 10-year span. And what they found was because of increasing healthcare insurance costs and also the fact that their employees were somewhat unhealthy, that their expected future 10-year healthcare employee insurance costs were going to exponentially increase from year 5 to 10. Healthcare was getting more expensive, and their people were uneducated about how to properly take care of themselves. Not to mention, what they found through some early data and research was that their people typically smoked a lot. They didn't move a lot. The job was somewhat sedentary, unhealthy. The environment is somewhat unhealthy. You know, gas station work, you're not really moving around a lot. And they were eating unhealthy food as well, more often than not. What they hoped to do from year 1 to 5, this was a 5-year project this company worked on, was to educate their people. That on our graph here on our one slide is represented by that blue line. The fascinating business case for this education was that at the end of 10 years, if the company was successful in educating their people on eating a little bit healthier, moving a little bit more, choosing a little bit of a better lifestyle, and most importantly, not just running to the emergency room when they were sick, because that is what cost the company a lot of money in their healthcare costs, that the gap from where the top of that red line ends around year 10 to where that blue line is, if they can educate people just a little bit, the gap there was represented by $150 million in savings for the company on their healthcare costs. Similarly, the way that this relates to May upcoming and Mental Health Awareness Month is if you have an understanding of the emotional well-being of your people and how they're feeling when they are in crisis, the same thing may be happening. And unless they are physically in harm or in trouble, they don't need to run to the emergency room. In fact, most emotionally intelligent leaders and companies are now building plans and situations for their employees so that when they do find themselves in a mental health crisis, they have a different option. A quick disclaimer, I am not a mental health provider in any way. I'm also not an expert in employee health insurance. Everyone's plans are very different. But beyond the fact that understanding how your people are feeling, their emotional well-being, and more, beyond the fact that that's just the right thing and a good thing to do for us as humans to do for each other, there's also could be a major business case for you looking further out to save money on your healthcare costs. This has been another little lecture with Professor Nat. Thank you so much for listening in. If you or your company actually want to participate, we have worked with clinicians to build a well-being, emotional well-being, employee emotional well-being assessment that we're rolling out in May, the next coming months. So let us know if you want to participate. You can contact us at yourculturedesign.com/mental health. We want to be part of the solution as quite honestly, more people need mental health services and more leaders should be understanding the needs of their people. So thank you so much. We hope you enjoyed this little lecture. Have a great rest of your day.